Hello, I'm Sean Gurlis, Certified ADA Coordinator, working with Disability Rights New York, providing this survey for people who have had experiences in healthcare settings with the use of an interpreter, or the lack thereof. There are 5 parts to the survey, multiple questions in each part. So please try your best to answer the questions. And if you cannot answer all of the questions, or you cannot recall the answers, do not worry. Any information we collect will be helpful. Part 1. Please provide your name. Date. Part 1. Question 1. Are you deaf, hard of hearing, other? If so, please explain. Part 1. Question 2. What is your primary method of communication? Do you use sign language, written notes, lip reading, gesturing, FM system, loop system, or something else? Please explain. Part 1. Question 3. Do you use sign language? If so, what kind of sign language do you use? Do you use American Sign Language, Signed English, Cute Speech, British Sign Language, or something else? Please explain. Part 2. Please answer the following questions regarding your 5 most recent visits to a doctor, hospital, clinic, ER, or other medical provider. Part 2. Question 1. Did you ask for a sign language interpreter before your visit? Did anyone ask you if you needed an interpreter? If not, please skip to question 2. Did the doctor's office, hospital, healthcare provider agree to provide and pay for an interpreter? Was there an interpreter there when you arrived or soon after? If so, did you have any difficulty communicating with your doctor and other staff through the interpreter? Did the interpreter use the wrong language? Was the interpreter fluent? Was the interpreter qualified? Did the doctor give the interpreter time to sign and for you to respond? Part 2. Question 2. If you did not request an interpreter in advance, did you ask for an interpreter when you arrived? If not, please skip to question 3. If so, did your doctor's office or hospital provide you with an interpreter? How long did it take for them to get an interpreter? Did you have any difficulty communicating with your doctor and other staff through the interpreter? Did the interpreter use the wrong language? Was the interpreter fluent? Was the interpreter qualified? Did the doctor give the interpreter time to sign and for you to respond? Did you have any other issues communicating? If so, please explain. Part 2, Question 3. If you could not get an interpreter, or if you did not use sign language to communicate, what other ways did you communicate with your doctor and other staff? Did you use gesturing, lip reading, written notes, CART, video relay interpretation, FM system, loop system, friend or family interpreter, or something else? Did you have difficulty communicating with your doctor or other staff? Part 3. If you asked for an interpreter and did not get one, or if your interpreter was inadequate, please answer the following questions. Part 3. Question 1. Did you complain to anyone at the office or hospital about not having an interpreter or otherwise being unable to communicate effectively? To whom did you complain? What was their response? Part 3. Question 2. Did you complain to any outside organizations or agencies about not having an interpreter or otherwise being unable to communicate effectively? To whom did you complain? What was their response? Part 4. If you are comfortable, please provide the name and address of the doctor's offices, hospitals, or medical providers at which you have had trouble communicating with staff because of a lack of an interpreter or other alternative means of communication. The fact that you provided this information is confidential and will not be shared with anyone without your permission. Part 5. Please provide any other information you think is relevant. Please share. Thank you for taking part in this survey. This information will be provided to Disability Rights New York, whose website is drny.org. Thank you. So if you would like to respond to the survey using American Sign Language, please do so. Go to YouTube and create a video and then save it as unlisted. Do not make it public or private. Save it as unlisted. Then copy and paste the link into an email and then send it to the address you see below. Thank you.